When I worked for SAIC early in my career, we had a saying, "Hi, I'm from corporate and I'm here to help." And what that meant was that when someone from corporate came out to one of the regional divisions and said, "Hi, I'm here to help," it means, "Hey, you're off your numbers and you better get back on your numbers, or we're going to have to make some changes here." And in this slide, I'm talking about some of the people that are there to help you as you go through this. These are some of the people that I've dealt with in my 3 years running Entra Health Systems. FDA, of course. FCC, we have to have an FCC license because we've got an RF chip in our device. CMS, we've heard about. Department of Homeland Security. Department of Homeland Security works with the FDA at LAX. I've had to become very good friends with Customs and Integration at LAX and also with the Department of Homeland Security at LAX just to get my product into the country so that I can sell it. And believe me, it's not easy. Every time I think that I have that paperwork down, there's something else that's wrong with it. And they hold up my shipment. I don't have Johnson & Johnson on it, Don. And so they look at Entra Health Systems and say, "Who the heck are these guys?" Even though they've seen this product come through, dozens of times already. State regulatory, California Department of Health, Board of Equalization, Medi-Cal. I've had two Medicare audits so far. I've had Medicare clearance now for about a year, and I've had two unnotified Medicare audits where they just show up and they want to start seeing things. And you hear these stories about millions and millions of dollars that are being paid to these empty storefronts, and they're getting this fraudulent reimbursement from Medicare. How the heck do they have time to show up and talk to me for a day twice in 1 year? Local regulatory, pretty easy, San Diego license and business license, along with quality system audits like ISO 13485, which is the ISO 9001 quality system for medical devices, HQAA and others. So lots of people that are there to help you. On the Medicare reimbursement side, it took us, I think from start to finish, it took us 14 months to get Medicare approval, just to sort of give you. And this is for a device that's a regular device. There are lots of predicate devices out there. About 1 in 7 Americans right now is covered by Medicare. So it's a huge and growing patient population as the baby boomer bubble goes through the system and baby boomers get older. It's under Medicare considered a durable medical equipment device. So from that standpoint, my meter is considered equivalent to all the other meters that are out there that have 510K approval, which is good because the reimbursement is there and I sort of know what it's going to be, even though it varies from region to region. As long as I get the paperwork right, I know what I'm going to be paid for that. Medi-Cal and private payers typically follow Medicare's lead, although from a prescription drug benefit, as opposed to a DME drug benefit, the reimbursement from meter to meter is going to vary, and I'll talk about that in just a second in one of my upcoming slides. Novel technologies typically will require new billing codes. Okay, the HCPCS codes and the Common Procedural Terminology codes for medical procedures. As novel technologies come out, the code system typically will not address some of these novel technologies, and that's especially true in wireless health. Again, we took the standpoint that said, here's our meter. Our meter is just like every other meter, so it can be billed under the same HCPCS codes as all the other blood glucose meters out there. And I am really happy that I didn't build that glucometer into a cell phone, because I would be still fighting that fight, and I guarantee you I would not have delivered one product in the U.S. yet. It's all about clinical trials, evidence-based medicine, downward price pressure, and competitive bidding in Medicare for blood glucose strips. What we're seeing is that Medicare is is trying to go out there and trying to really force down the prices of all these. There was a temporary hold on the reduction in physician reimbursements for Medicare because there was just a total outrage from the physician community. And so President Obama held up that. Competitive bidding started and then was rescinded by Congress last year. Now, for the first region within the U.S. that's involved with competitive bidding for blood glucose strips, that's out there. And what they've seen is a reduction in blood glucose costs to Medicare of 60%, okay, just because of the competitive bidding. Now, that's good and it's saving the government money, but it's bad if the product is not accurate. And so the message here is that innovative new technologies cost more. My meter costs twice as much to make with that Bluetooth module as a meter being built in China that basically does the same function, maybe not as accurately, but basically does the same function, but doesn't have this whole connected health piece. There are many, many implications from that standpoint, from a Medicare standpoint. So a couple of war stories. Formularies. I didn't even know what the heck a formulary was when I started down this road. Formularies are basically the drug and equipment lists that payers use to reimburse. You can be, if you're on a formulary and you're at a tier 1, you're in pretty good shape. If you're not on a formulary, you have a difficult time reimbursing. They'll still get you still might get reimbursed, but it'll be at a much less of a payment and much less frequently and a lot more paperwork. So you have to, if you can either be in or out of network. So what I've had to do with in California with Blue Cross, Blue Shield, Health Net, Aetna, is talk to all of them about about the benefits of my product, getting on their formulary. I can never get to tier 1 because tier 1 is one of the 4 big guys: Bayer, LifeScan, Johnson & Johnson, or Bayer, Abbott, LifeScan, and Roche. They're the guys that are always at the tier 1 because they've got the installed base and the cloud. So I'm always going to end up as a tier 2 or tier 3 reimbursement on these formularies. In many cases, in order to even prescribe a tier 2 or tier 3 meter, you've got to go through step therapy on many formularies. In other words, you've got to use one of the tier 1 meters, which is their meter that is a price advantage for the payer, before you can even try one of the more innovative meters. Again, not impossible to attack, and we've got many, many patients on the meter that have gone through and navigated all these. It's just more difficult to be able to do that. These are 3 of my new friends: Zirmed, Office Ally, and MDion. They're the clearinghouse people, so I submit a claim to them. They basically submit it to the payer. In many cases, they'll come back and say, well, your claim was rejected. They won't tell you why it was rejected. And you can submit and submit and submit, and you'll get sort of one-step rejection each time before you can finally get paid. So there's a lot of work involved. We've had a couple of claims that have been submitted 8 times and still waiting for payment.